Every year, about 690,000 women are diagnosed with cervical cancer. Over half, 350,000, end up in death. The majority occur in low-middle-income countries. We can do a lot about cervical cancer. It is the one cancer that we can prevent and eliminate. The HPV vaccine is a vaccine that has been proven to be safe, and if we give it to girls, they have a less chance of developing cervical cancer. Many countries have introduced the vaccine, but not enough have the coverage that is required. If we come together in workshops, we can exchange ideas that the participants can take back and try to implement in their own home countries.
I think it's a very good platform and a very good opportunity for events like this, because we meet with people like-minded with the same aim and determination for the cervical cancer elimination, and hearing lots of ideas that work in different scenarios has actually helped me.
UICC's membership is 1,100 organisations in over 172 countries around the world, and they really are at the forefront of cervical cancer elimination, and many of them have made really important progress in their different contexts. Alongside global advocacy efforts to ensure that cervical cancer elimination remains high on the global agenda, we work with the community to really try to bring this cervical cancer elimination agenda to life. So we provide learning and development opportunities, financial resources through grants and fellowships, and we also help facilitate the development of networks and collaborations to really support that development of the community.
One very good initiative that we have done is we have moved from pap smears to HPV self-sampling kit. So that is one step forward to reach cervical cancer screening better in Malaysia.
The Ministry of Health, together with NGO like GMK, we're working to spread more evidence-based information, to use champions and role models to promote how vaccination can prevent this type of cancer, which is one of the most common inside Ukraine.
Misinformation is a big barrier. People don't trust the vaccines. Some believe that they may cause infertility to their young girls. So I think we need to address that to increase the uptake. As palliative care providers, we go right to the patient and family households. And we thought it was a missed opportunity to go to households and offer care while all the girls in this household are not vaccinated. So when we had the opportunity to implement the UICC funded program, we were able to reach out to the young girls who are in formal caregiving roles, and they had access to cervical cancer prevention.
When we are calling girls and girls for vaccination, when they're going back home or going back to their school or colleges, they carry with them a colorful bracelet that they wear and go back to their college. This makes them feel it's not very serious issue and it's very light, that vaccination is not a complicated issue. And second thing, when these girls wear these bracelets and go back to their place of work or study, when others see that, they keep asking them like what they are wearing, how they got it, and they get to know that this is from the vaccination camp. So it is passively transmits the information from the person who's vaccinated to those who are in need of the information.
We are lucky to exist in a time when we have a vaccine that has been proven effective, we have the screening, and we have the ability to treat lesions early. What we need to muster more of is political will. If we muster the right political will, we can certainly eliminate cervical cancer.